Let's think critically. What are the steps in critical thinking? You've got your baseline knowledge. You then begin the process of how to think something through. Upon thinking it through, it becomes critical thinking. You are reorganizing your knowledge base. You're also creatively thinking and generating new knowledge and combining the critical thinking and the creative thinking in order to achieve the desired goal. There are three things that comprise critical thinking. One is knowledge, one is practice, and reflection. Knowledge is what you know, practice is based on the experience you have, and the reflection is, can I do it better? What could I have done? Insight, your personal thought process into how to accomplish the goal is pretty much the reflection. There are 4 stages in the critical thinking process. Preparation could also be viewed as the assessment piece. The incubation, which is pretty much the planning and implementation of what you're going to do. Your insight is reorganizing your thoughts. And your verification is your evaluation. Did I do things right? Did I do things wrong? What could I have done differently? And getting your outcome. In this mind map, it's pretty much a personal algorithm of how you do things and how you get things done, how you critically think through things to accomplish a goal, an idea, a process, or an outcome. THINK is a clever little critical thinking acronym that implies total recall, forming habits to facilitate thinking while the habit is undertaken, inquiry, or being curious and asking questions, N are new ideas and creativity, and K is knowing how you think and recognizing that you know or do not know something and how you go about learning and teaching these kinds of principles. Remember that the THINK principle correlates to the outcomes generated through the nursing process. So that's the reason behind the THINK concept, which it correlates critical thinking with the nursing process in order to generate the final outcome or the goal for the patient. Let's take a scenario where you are the nurse in the pre-op area. Your patient is 66 years old. He is a male with a fractured left hip. Surgery is scheduled for 8:15 and the surgery is a left hip RIF. So upon assessment, we're going to ask him what his name is, verify it with the chart, verify it with another form of identification such as his wristband, and making sure that we have the right patient for the right surgery. We're also going to ask the patient what type of surgery they're having. We're going to ask him what kind of allergies he has, last time he ate or drank, last time he went to the bathroom, medications that he's currently taking, does he have any medical conditions that we need to be aware of, what surgical history does he have, has he had former surgery in the past, does he have any implants, does he have any problems breathing or problems with anesthesia after the procedure or during the procedure. These are very critical questions that we need to be asking in order to assess our patient adequately so there is no complication or no associated harm with the surgery or going to sleep for surgery. At this point, I'm going to go back to the room and I'm going to hope that I have everything I need for my patient. I'm going to make sure that I've got enough positioning devices, I have the right table, first of all, for the procedure. If it's a left hip, we want the operative side to the sterile field, so I have to make sure that the room is adequately prepared for that scenario. I also need to check and make sure that there are plenty of safety precautions for my patient. Do I have a safety strap for him so he doesn't fall off the bed? Is the bed the correct bed for my patient? Do I have enough positioning devices so he doesn't get any nerve injuries? Do I have the correct medication on the field? Do I have the right instrumentation? Do I have anything that needs to be sterilized that is not sterilized? Now's a good time to start doing that. Do we want to flash the instruments? Probably not. We'd prefer that the instrument's already sterile. Remember that flash sterilization is only utilized for emergencies only. If something fell on the floor or somebody brought in something at the last minute that absolutely needs to be done. So other things now that I need to prepare for, I need to do a count. I need to make sure that my scrub tech or my scrub nurse is in the room and we're ready, that she's ready or he's ready with all the necessary things that he has to have on his field. We need to do a surgical count. We need to make sure that we have adequate sponges, that we have adequate instrumentation, adequate towels, all the necessary things that we need for the procedure to get started. Once all this is done, I then begin to go back to the pre-op area and get the patient ready and take them back to the operating room. One of the things that I do here is I prepare the family. I tell the family, okay, it's now time to be taking the patient back to surgery, and I will show them or escort them to the waiting area, and at this time I take the patient back to the operating room for surgery. So we've now completed the surgery and we're in the recovery room, but prior to that you want to give report and let them know that, one, how the surgery went, any kind of assessment that you did prior to leaving the room, and in this case, if it was an extremity surgery, you want to check pulses, you want to check skin color, you want to check capillary refill, movement sensation, circulation, those kinds of things. And then lastly, you want to let them know about the dressing, what kind of dressings you used, and any other pertinent information they need to know.